can I please welcome Dr Oana Marian from the University of Sydney, who's the most recent recipient of funding from the Dementia Research Community.
It's an absolute pleasure to be here tonight. Thank you for having me. First of all, I'd like to say a huge thank you to the Dementia Research Community for inviting me to speak tonight about our research that I'm really passionate about and for funding this research project. So I work at the Charles Perkins Centre at the University of Sydney, and my goal is to improve the diagnosis of dementia. So tonight I'm really excited to be talking to you about our project looking at plasma lipids to improve the diagnosis and monitoring of frontotemporal dementia. Works. So frontotemporal dementia is a form of dementia that many of you here tonight might be familiar with. It's the second most common cause of younger onset dementia, and although it can affect people at any age, its onset is commonly before the age of 65 years. So as the name suggests, this form of dementia primarily affects the frontal and temporal lobes of the brain, and this leads to impacts on a person's personality and behaviour, their language and word production and fluency. Despite substantial heritability in frontotemporal dementia, up to 80% of cases are sporadic, and so its onset can be even more surprising given no family history of dementia. So improved diagnostic tools are sorely needed for frontotemporal dementia, and this is evidenced by the fact that in Australia it can take 4 to 7 years to achieve a correct diagnosis of FTD. So clinical presentation is highly varied and symptoms can overlap with other forms of common neurological diseases. And so as a result, misdiagnosis is common. So correct and timely diagnosis is essential for improved outcomes, both for people with frontotemporal dementia, but also for their loved ones, to gain an understanding of the condition, to seek appropriate treatment and support, and to prioritise people to enter into clinical trials for emerging therapeutics. Without a diagnosis, that can't be possible. So unfortunately, there are no disease-specific indicators for frontotemporal dementia. So we term these biomarkers, something that says, yes, you definitely have this disorder and not this one. And this makes diagnosis even more challenging. So changing speed a little bit, white matter makes up about half the human brain volume. And it's less talked about than your grey matter, but it's something that I'm really passionate about studying. And so white matter gets its white appearance from the high proportion of fat in this brain region, or throughout the brain. And it gets this white appearance from myelin. And so myelin is the fatty substance. You see the cross section there. It's this fatty membrane that surrounds neuronal axons, and it acts almost like an electrical insulation. So it's deposited along your neuronal axons, and it increases the speed and efficiency of electrical messages along neuronal axons. And this is essential for brain health and normal human cognition. Now, unfortunately, it's been discovered through brain MRI studies that white matter is progressively lost in frontotemporal dementia, and this occurs in the brain regions which are heavily affected by FTD, and it's strongly associated with disease severity and progression. In fact, it's more severe than in other forms of neurodegeneration, such as in Alzheimer's disease, and it's a really early feature in the disease, actually. So it's been noted in some studies of people who have genetic risk for FTD up to decades before symptom onset. So this gives us a clue that this is a really important, potentially really important early feature of the disease. And if you look at the brain scan, you can see, you probably can't see really well, but there's an arrow pointing to these areas sort of in the middle of the brain that have these hyper-intense white. And these are areas of decreased white matter integrity, so white matter loss. And so MRI is a really great tool to allow us to visualize these changes. But unfortunately, it doesn't come without its limitations. It's an expensive modality. There can be barriers to access, especially for people who live regionally or remotely. Extensive expertise is required to interpret these brain scans, and is not appropriate for everyone, especially for people with FTD that are quite advanced in their dementia. And so unfortunately, this is not really a practical tool to monitor disease progression. And so because I work on lipids, this is what I did for my PhD, and this is what our lab is really excellent at, we wanted to know whether we could measure brain-specific lipids in blood samples. So without having to look in the brain or do a brain scan, but can we actually quantify these molecular features in the periphery? And so as part of my PhD, I developed a technique to actually identify the specific lipids that are found in the brain. They occur in really small levels in the blood, but we have a way to measure them now, and that's really exciting. So the brain-specific lipids that make up white matter can be measured in blood samples, and the levels of these brain-specific lipids in the blood may reflect brain changes. So to this end, preliminary data from our lab in a group of people with behavioural variant frontotemporal dementia and healthy controls showed us that brain white matter lipids in the blood were actually at lower levels than in healthy control individuals. And this correlated really strongly with disease duration. So the longer that people had FTD, the less of these brain-specific lipids were in the blood. And then additionally, we were lucky enough to have matched MRI scans from these individuals from which we had blood samples. And we actually saw that brain white matter lipid levels in the blood decreased in line with loss to white matter integrity in these people. So the less white matter integrity you had, the less of this lipid was seen in the blood. And this is important because it gives us an opportunity to see something that reflects critical brain changes in a really sort of easy to test manner. So we believe that brain-specific lipids hold significant promise to accurately reflect the presence and progression of frontotemporal dementia. So the aim of this project is to assess white matter lipids in the blood to improve the diagnosis and monitoring of FTD. And this will be done with the help of a study cohort of participants recruited from the Frontotemporal Dementia Research Clinic. This is based at the Brain and Mind Centre at the University of Sydney, and it's the largest FTD clinic in Australia. And so this study cohort will comprise people with the three major clinical syndromes of FTD. So these include the behavioural variant of FTD, progressive non-fluent aphasia and semantic dementia, as well as a group of people with Alzheimer's disease and healthy controls. And what this will allow us to do is look at how these different clinical syndromes of FTD, because they do present quite differently clinically, how do they differ from each other, and how do they differ from other forms of neurodegeneration, such as Alzheimer's disease, which is the most common form of dementia. So all of these individuals had blood drawn, they've had comprehensive clinical assessment, and they've had brain MRI. And importantly, this cohort of individuals have been followed up for a number of years. So we can actually map the clinical trajectories in the same individuals over time, which is an incredibly powerful tool. So the first stage of this project will be to undertake a comprehensive blood lipid analysis. Now, I just want to quickly state here that this is not the same as having your HDL or your LDL measured at the GP, but this is measurement of hundreds of different structurally diverse lipid molecules that have really specific functions. And this will allow us to identify the best diagnostic biomarkers across all the FTD syndromes. Following on from this, we'll perform advanced MRI analysis of white matter integrity in each of the major FTD syndromes. And this will be using a technique known as pixel-based analysis, which will give us finer detail than has been achieved to date. It will allow us to determine how brain white matter looks in each of these major clinical syndromes, and also how it looks in Alzheimer's disease and how they compare to healthy controls. This will also allow us to uncover the relationship between the abundance of white matter lipids in the blood and brain white matter loss in the same individual in a cross-sectional manner. And then finally, we'll take elements of phase 1 and phase 2 to evaluate changes to blood lipid levels and white matter integrity over time. So this will allow us to map the white matter trajectories or the trajectories of white matter changes in each of the clinical syndromes, and also how blood lipids are changing over time. And so this will allow us to determine which brain lipids in the blood best reflect FTD progression to enable the development of a blood test to monitor brain changes over time in a minimally invasive manner. And this, we hope, will be able to allow us to sample whenever needed. So if someone enters a clinical trial and they want 6-month follow-up, how's the patient doing? Are they stabilising? Are they getting better? This will allow us to actually ask those questions. To answer those questions, sorry. So the expected outcomes for this project are to lay the groundwork for the development of a blood test to improve the diagnosis and monitoring of frontotemporal dementia. Importantly, this will also improve our understanding of the lipid changes that occur in each of the major FTD syndromes and uncover the fine-grained detail to which white matter is actually affected in each of the FTD syndromes and in Alzheimer's disease to greater detail than before. The implications of the research are considerable for improved diagnostic capability, for improved clinical monitoring and management of FTD, an increased ability to evaluate the success of therapeutic interventions, and really importantly, an improved understanding of the biological causes of FTD, because this is something that we can then build on for looking towards a cure in the future. So finally, I'd like to thank my co-investigators. These are global experts in lipid biochemistry and mass spectrometry, in neuroimaging, clinical FTD, and a lived experience of dementia. I'd also like to acknowledge the Frontier Clinic at the Brain and Mind Centre and all of the participants who have generously donated their time and their samples for medical research. I'd also like to thank the Dementia Australia Research Foundation and, of course, the Dementia Research Community for actually funding this work tonight. And thank you all for your attention. I look forward to chatting to you about it tonight. Thank you.